This video will guide you through a handful of starting points for trying to come into a more moderate and tamed relationship with alcohol or marijuana. Moderation is the middle ground between complete abstinence and sobriety on one side and full-blown addiction and daily dependence on the other side. Moderation is for those who have made the decision to keep using a certain substance, at least for this period of their lives, but who also don't want it to get so out of hand that it holds us back in any way. Without strengthening skills in moderating substance use, it can be really easy for drug or alcohol use to get out of hand. Substances can harm our health or mess up our finances. They can restrict our ability to perform our roles and responsibilities. Sometimes they really start shaking up relationships or prevent us from growing. Moderation is a lifelong skill that we nurture in many aspects of our lives. We use moderation skills sometimes with what we eat, or with how we spend our time and energy, or with how we spend our money. So if you want to shape your relationship with a substance so that it's in a more moderate state, consider experimenting with some of the following paths. Number 1, know and revisit your reasons for cutting back. What's inspiring you to try to move in this direction? It might be to save money, or care for your health more, or to help you keep up with a job or school. It might be to regain some more energy or to challenge yourself, or to prove that you're not addicted. Write down your reasons. It's helpful to sometimes revisit your list of reasons when you're getting ready in the morning or when you're experiencing cravings and need a refresher. Number 2, tell other people about your plans. Letting other people know about your consumption goals is helpful for a few reasons. When loved ones know about a personal goal of yours, you have people to cheer you on, to lean on, and this builds momentum to be accountable to your goals. It also alerts some people that you might need to modify plans sometimes to reduce triggers and cravings. Number 3, start with really easy and reachable goals. What is your ideal relationship with this substance? Is it going from 5 days a week of drinking to just drinking on weekends? Is it going from smoking weed every hour of the day to just smoking in the evenings of each day? Is it going from getting high 7 days a week to just getting high 2 days a week? Once you've chosen your ideal goal, now give yourself 6 months to reach that goal. If that seems like way too much time or not enough, then modify that number. And that number can change again too, because these are your goals, no one else's. Now that you know what your end goal is, now start picking tiny goals that build up to it slowly. So instead of being like, oh, I need to overnight jump from extreme use to barely any at all, we can choose to be a lot more reasonable to ourselves, more forgiving of ourselves, and break this goal down into more manageable steps. So, for example, if you smoke weed from the moment you wake up to the moment before sleep, then your first tiny goal is to simply delay your first hit for the first 2 hours of the day. Turn a day of having a 16-hour high to a day of having a 14-hour high. Give yourself a tiny goal that is feasible to accomplish without extreme effort or pain. Once you've demonstrated a week or 2 of going 2 hours in the morning without getting high, then you can advance to the next level that you create. And perhaps go 4 hours in the morning without getting stoned until that becomes manageable for a couple weeks. This is a way of setting yourself up for success. Small successes and some trial and error soon add up to large successes if you keep at it. Number 4, lean on coping strategies that help with oral fixations and fidgetiness. We tend to drink alcohol or use marijuana with our hands and mouths. We hold on to a bottle or a joint and put them to our lips, and repeat. So it's going to be helpful to do other things that satisfy that mouthy and handsy compulsion you've developed. For your mouth, you can chew on gum, eat nuts, or suck on cough drops. You can chew on a pen or eat crunchy vegetables or drink non-alcoholic carbonated beverages. For your hands, you can write and journal or color or doodle. Play an instrument, do puzzles, or play with Play-Doh. An effective way of easily accessing these tools is to carry a bag that has a few of these items in it. We've gone through 4 starting points for coming into a more moderate relationship with alcohol or marijuana. If you'd like to explore additional paths, check out Part 2.